Well, that's right, Reed. The governor taking a stern but also somewhat hopeful stance today on how the state is handling this crisis. You mentioned the overall cases, upwards of 1,946 fatalities statewide thus far. A couple of areas that are still lacking, he pointed out. One is the need for tests, those test kits that are so vital. He says they've been slow to arrive. They've asked the feds for more. They have not arrived just yet. He specifically said the more people we can test, the better we will know the situation and be able to control it. Also, he stressed the need for ventilators and PPE equipment, another area where we are still struggling. Currently, we have 838 ventilators statewide. He has asked the federal government for another 450, but here again, we are still waiting. More than 1 million pieces of PPE equipment, this is good news, have already been distributed to Nevada hospitals, but he says we are still short. In fact, we're still far short. Many donations, however, of PPE are starting to come in. And today the governor said that they've activated 100 National Guardsmen to help distribute some of these donations and these supplies, including a very generous supply from Sheldon Adelson. Once again, though, in terms of what the general public can do, he said the primary thing we can do to fight this crisis is to social distance and stay home.
For those of you who aren't doing your part, I want you to know how much I'm disappointed in that as well.
Again, that's the stern part that I mentioned at the top of my report. He specifically mentioned Easter, which of course is coming up this weekend. He stressed no large family gatherings, no 12-person dinners this year. The governor also described our hospital readiness as a state of yellow, but he said with those additional donations coming in within maybe a few days, hopefully by the end of the week, we can bring that up to a green. That's somewhat optimistic, but he's hopeful that will be the case. Also, at the start of his press conference today, Reed, he handed out these red ribbons like the one that I'm wearing on my lapel. He had a whole box of them, and he encouraged everyone in Nevada to start wearing these in support of our frontline workers. We're talking about nurses, doctors, firefighters, police officers, anyone who is out there who cannot social distance because of the general nature of their job.
The latest projection is giving us here in Nevada a look at just how bad the coronavirus could be. At the same time, if we all do our part and take social distancing seriously, the outcome could mean a turnaround by the end of April. Our Faith Jesse joins us live from the Southern Nevada Health District. So Faith, kind of break down these findings for us.
And you know what, Chris, I'm glad you mentioned the turnaround, because that's what I want everyone to really focus on here as we go through this report, not to be fearful, but to be prepared. And we mentioned social distancing. You've been hearing about it for weeks, but this new report is showing that the peak in our state is very near, meaning it is time, and it's been time to buckle down, but to really take this thing seriously, social distancing, so that we can get through this and back up and running as soon as possible. Take a look at these new predictions that are put out showing what could happen here in our state. According to the projection by the Institute for Health Metrics and Evaluation, the IHME, Nevada's peak for resource use to treat those with severe coronavirus symptoms is about 12 days away. On April 18th. The projection also shows that the peak for COVID-19 related deaths in our state is about 14 days away, with about projected 50 deaths on a single day, April 20th. Now, this is just a projection. As for our medical resources, the IHME is projecting that Nevada is short about 300 ICU beds and that the state is projected to need about 411 ventilators. Now, assuming full compliance with social distancing through May, Nevada could see success in flattening the curve. The IHME is a health research center at the University of Washington, and according to the center, they are using data from local and national governments, the World Health Organization, and hospital networks for these data models. And it's really important to note that these are projections. Nothing is set in stone. There's a margin for error. For example, the data model projected that Nevada would see 72 total COVID-related deaths by yesterday, Sunday, April 5th. Instead, the state reported lower than that, 46 deaths. So the data is changing daily. The actual results could be higher or lower, but the biggest thing to take away here, guys, is social distancing. Do your part so that we can get through this together. The IHME also predicts that the Nevada curve could flatten by the end of May if we stick it down, do our part, call out our neighbors, call out our families, and social distance.
You know, despite the governor's stay-at-home order and businesses like bars and casinos being shuttered, some people continue to get behind the wheel and drive impaired. Our Max Darrow joins us live now. And Max, the DUI strike team, they say they're as busy as ever?
Yeah, they're learning that they're seeing a slight increase in DUI arrests. In fact, over the course of 8 recent shifts, I'm told they made 48 arrests. Stay home for Nevada does not mean stay home, have a few drinks, and get behind the wheel. To Andrew Bennett and Valley Law Enforcement.
Have a great time at home. Just don't get behind the wheel impaired.
The coronavirus is stopping people from driving to and from bars, but Bennett says the newly expanded 10-person DUI strike team is finding the virus is not stopping people from driving impaired.
But the 48 arrests from the strike team in those 8 shifts is concerning. It's a combination of alcohol, marijuana, prescription drugs, or multiple of those substances in their system. You know, not much has changed, and that's disheartening.
I think that the numbers right now are reflective of what's going on with everything else.
Kathleen Bienenstein with Mothers Against Drunk Driving says though she's not surprised by the numbers, she is disappointed. After all, unless you are out on essential business, there's no reason to be getting in a car to drive around, per the governor's order.
No, you're not, but it doesn't seem to stop people.
She asks we all think about our friends and family, pandemic or not, and their safety. There's never a reason to go out and put others in danger.
If you're enjoying the beer on the couch, please stay on the couch.
However, Bennett and the strike team are well aware there will be people who don't stay on the couch after a few glasses of wine. So they're working hard to make sure those people don't hurt anyone else or themselves.
Traffic enforcement has not stopped, and we do have the resources out there that if you choose to drive impaired, you will be caught and prosecuted to the fullest extent of the law.
All right. Okay, now after all the gyms closed their doors, many of you at home have probably been trying to figure out ways to stay in shape during this social distancing phase. Reed's laughing, and I'm laughing inside as well because I have. Jesse Merritt caught up with UNLV football's head strength and conditioning coach to see how those guys are taking home workouts to a whole nother level.
What's been the biggest difference in kind of what this time has been like for you?
Strength conditioning is a real intimate industry. I mean, you're in there with 30 to 40 guys at a time in the weight room. It's really hard to replicate the energy that we get inside the weight room with these guys. So obviously taking that to a virtual standpoint in combination with the different types of training that we're doing now.
So like obviously these guys are doing home workouts. I don't know how many some of the kids maybe do or don't have some sort of like home weights type of thing. How do you go about making sure the guys are in playing shape if and when you guys do come back?
We want to stress the soft tissues and things like that. And there's plenty of stuff around our house. You know, a couple weeks before we hit spring break, we did some single leg squats. Guys were throwing up, 500 pounds. And obviously we can't replicate the load, but we can replicate the volume. And if you look around your house, there's tons of things. I'm sitting in the chair right now. This is the same chair that I did single leg squats, 12 each side on our competition last week.
I've seen a lot of stuff on social media. It's been great to check that out. I mean, for you, seeing it and seeing your team kind of rally like this and just adapt, what's that been like for you as a new strength coach?
It makes me miss the players even more, just seeing them, click mute on Zoom and then bust out a 20-minute workout real quick, or a 20-minute yoga session, a challenge, things like that. It makes me hungry and ready to get back to it.
That's awesome, man. Well, hey, thanks again for your time. Obviously, I'm sure you guys will be ripping the doors off the weight room once you get the opportunity to get back in there.
No doubt. Absolutely.